New technology shining a light on how a brain works in someone with a potential eating disorder, and it could help doctors better access treatment. Dr. Jacob Dubroff joins us now to share how the nuclear medicine scan works and talk about the impact for families. Appreciate you joining us this morning. All right, we're having a little trouble hearing you right now. Hopefully we can get I think it might just be in the connection. There we go. I think we have you now. Good morning.
Good morning. Thanks for having me, Steve.
Loud and clear. So first of all, talk about what you're able to learn now by doing these scans and how that can help, I guess, doctors and potentially patients in the future.
Yeah, thanks, Steve. So with nuclear medicine PET imaging, we're able to look at the neuroreceptors in the brain as they're actually working. And with this particular study that was done in some adults, half of whom were obese and half of whom were normal, they demonstrated that their actual brains responded differently to looking at pictures of food in one part of the brain. Meanwhile, in a different part of the brain, normal people who were not obese, their brains were different in terms of society, how they felt when they were full and satisfied with food. So when we think about obesity, we think about, is it a character flaw? Is it someone that they just can't stop eating? But maybe this is making us think, this nuclear medicine PET imaging is making us think maybe people who are obese are actually wired differently. And that makes us think about the disease differently.
Yeah, I mean, it would be a huge development if that, in fact, is the case. And I know you said this is a study you did with adults, not for kids. Is there any way to tell if this is something that those receptors could have changed the way they view this over time? Maybe if you've already established certain eating habits or you're already at a certain point in your life where you're more obese or less obese?
Well, that's a good question. So there's an obvious association between childhood obesity and then adults who become obese. And in the trends in this country have been alarming, in which we have, upwards of 40% of our population obese. But maybe first we should define obesity, which is a body mass index, a BMI, which you can calculate your own online, of greater than 30. It's a little different in children, where you have to look at how fast they're growing. But this trend kind of perseveres from childhood to adulthood, and then it manifests in lots of negative health outcomes. The biggest challenges that we have to Americans and their health: stroke, heart attack, and certain types of cancer, diabetes. All these things are related to obesity. So that's why it's a big problem, and we don't want to see it grow and transfer from kids into adults.
Yeah, absolutely. So if this, in fact, is showing that somebody might be a predisposition to this, or however that might be, to obesity, what might change, I guess, then in how they are treated, or the advice that you would give to someone who is currently obese?
So first of all, if you have a question about that, you should ask your own physician about how to address your obesity. But I think in terms of what medical science could teach us with nuclear medicine PET imaging is maybe we should be looking at different neuroreceptor targets for how we address it. We address obesity a lot with metabolically. We've done gastric bypass surgery, but maybe there's a different way in terms of how we use medication or how we use behavioral therapy to change our approach to managing obesity.
Sure. Last question for you, because you mentioned the gastric bypass. A lot of people, maybe if they're looking to make that serious change, they might lean in that direction just instinctively, because you hear about it a lot more than the nuclear PET scan. Would you recommend the nuclear PET scan for one person over another? Is there somebody who might be better off getting it, or is it not necessary?
So this nuclear PET scan is not something your doctor can order. It was done as an experiment. And any decisions about your strategies and how you can lose weight, you should discuss with your doctor. But the nuclear medicine PET is giving us clues into how we should all approach obesity, and how different challenges in weight loss can kind of manifest in our bodies. So I think it's not something that you need to go and run and look for a certain type of scan, but it's kind of giving us clues in terms of what are going to be the new approaches that we can figure out how the brain is wired using nuclear medicine PET imaging in patients, to figure out how we can treat them better.
Absolutely, when you look at the big picture, for sure. It's fascinating research. Thank you so much for sharing it with us this morning. I appreciate that.
Great to be here. Thanks for having me.
All right, Dr. Jacob Dubroff, thanks very much.